Pathogens certainly have the ability to compromise our gut barriers. So different bacteria that we may be exposed to from food poisoning can cause a process that disrupts the tight junctions. Parasites, other pathogens. Diet lacking in nutrients or a diet that's inflammatory kind of weakens our immune system's ability to respond, right? Toxins or irritants, and some of these are necessary things, but we still have to acknowledge that they can damage the gut. So chemotherapy will definitely damage our mucosal cells, those epithelial cells. Food sensitivity panels, I think, can also be helpful. I recognize that they're kind of controversial, particularly in conventional medicine. I tend to find them helpful. So these are not allergy tests. They are sensitivity tests. They're looking at IgG, which is like a delayed immune reaction, or IgA. But mostly they test for IgG. Most of the common ones test for IgG. You can do a spot test where the patient at home just like pricks their finger and like puts it on a piece of paper. I really prefer like a full blood test because it gives you a little bit more information when you do that. Polyphenols in foods and herbs are so good for our gut function. They're full of antioxidants. They're excellent food for the microbiota. You know, you could take any of these herbs, blueberry, cranberry, and like pick a condition and look it up in PubMed, and it's going to be like, oh, cranberry does that. Oh, blueberry does that. They do everything because they're just so darn good for us. So we know that they decrease inflammation. They're antioxidant. They help with mucus secretion. They nourish the microbiota. So like almost every layer that we're trying to treat is affected. And so we can just talk to people like, how do we get more blue, purple, naturally blue, purple foods in their diet?